that's the hardest part, is you know, they've been your caregiver. You know, I mean, she's the one who raised me. She was the one who was there for me. Same thing with my dad. You know, he was there for me. So you don't want to, you feel like you're doing something to them. And I have to say, my grandmother was in a nursing home, and long-term care facilities have changed so much.
The kids have often told their parents, I will never put you in a nursing home. I mean, I just hear that so often. And yet it's usually, that issue usually comes up when somebody has said, at the end of my life, I don't want to go to a nursing home. So I'm usually saying, what are we going for? Are we going for short-term rehab? Are we going because it's end of life and there's nobody that can provide this level of care? What is the reason that we are talking about nursing home care? I think there's a whole list of things that you do. At the beginning, I think the Medicare Compare website is a good beginning spot. Talk to your friends and neighbors that you know and their experiences. I would say there is no substitute for going out yourself and looking. I can tell you maybe 4 facilities that might suit your father well or your family member, but then you go out and you look and go unannounced, take a tour, walk around the building, watch staff interactions with the residents, take a look at the kind of residents who live there. Go a couple times if you're interested. Go at mealtime, see what the meal looks like, how many people are actually eating it. There's no substitute for just going yourself and kind of trusting your gut.
Somebody told me once that you need to go look at the kitchen, you know, and if the kitchen's clean and the people have their hair back and the way they're supposed to be, that says something also about. I never went and looked at the kitchen because she was already there when I heard this, but that's one of the things that I was told, because that doesn't, you know, they can't really go in and mask that.
Their memory care facilities, you have to really research and check on these places at odd hours, be a drop-in, and to see if you're gonna, if the people who are there are getting the care that you're expecting. I did not find that.
What did you find?
People left alone, wandering. Some of that's, you know, I think is expected because it's a safe environment in most memory care places. There's doors that are locked and everything loops back up to the main door. But I think in general, you want workers who are there, nurses, LPNs, CNAs, you want them to, they enjoy their work. That's what you want, and that's high burnout, and I think that's difficult to find. You start early. You start way before the need is there. You make a list, and as you're visiting places or making calls, you ask the questions. Because sometimes I compare it also to someone wants you to play a new game, but they aren't going to tell you the rules.
The most important thing, and in spite of all the experience I've had with having 3 elders over the last few years, I think the most important thing is to kind of anticipate that it might happen, even though like in my case here, I was trying to tell myself, it won't happen, he'll be able to stay here till the end. So it would have been better if I'd been thinking, you know, it could happen. I should be going around and visiting some nursing homes. And visiting a nursing home is tricky, or any other adult care facility, because you need to stay there long enough to get a little feel. And if you just take the tour, that won't happen.
Even though we think that we're doing them good by being at home, I know that those things have been good for my mom, and I wouldn't have done those things for her. You know, I mean, I would have taken her to my house to dinner or to the store or whatever, but I mean, she's gone and sat and watched the fishermen, and you know, she's gone and, you know, I mean, one time a guy caught a fish and brought it on to the bus, and she was excited about that, and she told us about that, you know, when we came in to visit afterwards, and those things she wouldn't have had being at home. As children of someone that may need care, we have to listen to our head, because I think our head's telling us what we need to do, and that's not that easy.